What is About.com? You are listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Susan Dolan, your host, and with me is Angela Morrow, a certified hospice and palliative care nurse in San Jose, California, and a palliative care guide for the website About.com. Angela, welcome to the Clinicians Roundtable.
Thank you, Susan. Thank you for having me.
Tell us about About.com.
Well, About.com is an online neighborhood of experts who are all eager to share their knowledge with users. There's currently about 750 guide sites, and they cover a wide range of topics from health and parenting to food and entertainment to travel and technology.
Describe your role for About.com.
Well, I am the guide to palliative care and hospice. So as a registered nurse, I share my knowledge with users about topics that are related to palliative care and hospice. And I cover kind of the entire spectrum of palliative care, from receiving a life-limiting diagnosis through making informed healthcare decisions, symptom and pain management, all the way to death and beyond.
What led to your interest in hospice and palliative care?
Well, I actually started my nursing career in an intensive care unit, and I was fascinated by the technology and really fueled by the adrenaline in the ICU, but I bore witness to so many bad deaths in the ICU, and one in particular that comes to my mind was an elderly man who had terminal cancer, and his family wanted to keep him as a full code in the ICU, and he died while we were performing a code on him, and I was doing chest compressions, and he was being intubated, and I remember thinking to myself that there has to be a better way. And after taking 6 months maternity leave, I couldn't drag myself back to the ICU. So a friend of mine was actually working in hospice and recommended that I give it a try, and I haven't looked back. I've really found my niche in palliative care and hospice.
Is that what you're doing now?
Yes, I actually work for Hospice of the Valley, which is a community nonprofit hospice agency here in San Jose, California, as an intake and admission nurse.
How did you get the job at About.com?
Well, Susan, I was browsing the internet looking for hospice and palliative care resources that I could direct my patients and their families to, and I came across the About.com site, and they were advertising for a guide to palliative care. And I became really excited at the prospect of increasing public awareness of palliative care and providing a sort of one-stop shop of information and resources for patients, families, and professionals about palliative care and hospice. So I applied with About.com and was accepted, and I'm just thrilled to be a part of that community.
How much time do you spend managing your site?
Well, I spend about 12 to 16 hours a week, and that's answering emails from users, maintaining my forum. I maintain a blog on my site, and writing content that is relevant and useful to users.
What is your forum?
My forum is a community where users can go and ask questions, offer their own advice, or just vent their feelings in a really safe, non-threatening environment.
Give us some examples of what's posted in the forum.
Well, recently, one of the busier forum posts was a woman whose husband had just recently passed away, and they had moved from their hometown about 6 months prior to his death, and she really felt abandoned by her family and by her friends in her community, and really felt alone during the whole process of caring for her dying husband. And even after he passed away, she really didn't have the support of her friends and community. And she was able to come to the forum and vent her feelings.
Did she have hospice?
She did have hospice, yes.
So that hopefully made a difference.
I hope so, yes.
Tell us about the feedback you've received from readers.
I've gotten a lot of questions from caregivers who are caring for loved ones that have either a terminal illness or are actually going through the dying process. I've received questions from healthcare professionals that don't deal with the dying process on a daily basis and just want a little additional information. And I've actually received emails from different parts of the world. One student in Sierra Leone wrote me and told me that she was using some information that I had written about physician-assisted suicide and euthanasia for a symposium that they were doing in Sierra Leone. So that was pretty exciting.
So you're global.
I guess so.
Have you gotten any feedback from physicians?
I haven't gotten a lot of feedback from physicians, no, unfortunately.
Are any of the guides on any of the other healthcare sites managed by doctors?
Yeah, there's several sites that are managed by physicians.
Can you give us some examples?
The pediatric site, there's a site about drugs that's managed by a physician, and a lot of the other health topic sites that are really medically based, such as cancer and podiatry, those sorts of things are managed by physicians.
If you're just joining us, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Susan Dolan, your host, and with me is Angela Morrow, a certified hospice and palliative care nurse in San Jose, California, discussing her role as a palliative care guide for the website about.com. Angela, is there a way to track how many hits your website is getting?
Yes, absolutely. We are provided with a weekly report of how many hits we're getting to the website.
And how is it advertised? How do you get the word out about the resources you're offering?
About.com does their own advertising, and I've reached out to local hospices and other agencies to get the word out about my site. I also promote my blog on other areas of the internet like Technorati, so hopefully they're passing the information on to their patients and families as well.
What do you like best about this job?
Well, this job has really provided me with an outlet to raise awareness of palliative care, hospice, and other end-of-life issues, which is really a passion of mine. I'm provided with opportunities to help real people through one of the most important and certainly one of the most intimate times of their lives. And that's really something special to be a part of.
Tell us more about the difference between palliative and hospice care.
Well, palliative care can be implemented at any time in an illness. For instance, if a patient has cancer and they're going through curative treatment such as chemotherapy and radiation, palliative care can be very appropriate for those patients to manage the symptoms that stem from the disease itself or from the treatments that they're receiving. Where hospice care is really appropriate when a patient has decided to forego curative treatments and to focus more on the comfort and the quality of their life. And a patient has to be certified by 2 doctors to have a life expectancy of 6 months or less to qualify for hospice. Where palliative care, a patient can have an extended prognosis and still be eligible to receive palliative care.
Angela, what do you think are the biggest misconceptions people have about hospice?
Well, I think the biggest misconception is that hospice is strictly end-of-life care. And while hospice is end-of-life care, it's not only for the dying patients. And I think too many people wait until the very end of life to utilize hospice. And there's so much more that goes along with end-of-life care than just the pain and symptom management. It's really about coming to the end of your life with a sense of completeness and closure. And hospice can help patients and families attain that through managing their physical symptoms, such as pain and other distressing symptoms, but also by addressing their emotional, social, and spiritual needs. That type of work takes time, a lot more time than the average of 2 weeks that most patients spend in hospice. So hospice really is best utilized as early in the disease as is possible.
What feedback are you getting from patients' families in your work as a certified hospice and palliative care nurse after the death?
Patients' families are so thankful for hospice and for the support that they've been offered. They're eager to talk about their experience and to be able to talk with people that can identify with what they've gone through. And the support that hospice offers its families, even after the death of their loved one, is enormous. And the patients' families really are thankful for that.
Angela, do you hear families saying, I wish I'd known about hospice sooner?
Absolutely. That's something I hear all the time.
Do you have a story you can share about the difference hospice can make?
Recently, I had the honor of helping care for a woman who was quite young. She was 42 and had terminal cancer. She had 2 teenage daughters and a 2-year-old little girl. And with the help of hospice, we were able to bring her home, make her comfortable within her own home, where she could interact with her children. She could cuddle with her 2-year-old in bed, which she wouldn't have been able to do in the hospital, and spend time with her teenage daughters and her husband while receiving the support of hospice, and while her children were receiving the support of the social workers and the chaplains to work through all of the emotions that they were feeling, watching their mother go through this. And even after her death, we're still working with the children and with her spouse to help them through the bereavement process.
Angela, how can listeners find your particular site on the web?
Well, Susan, they would just go to www.dying.about.com. And you can also find the website by going to about.com and navigating through the Health channel, and you will find palliative care under that as well.
Were you always a writer?
No, actually. This is pretty new for me, and I'm really enjoying it.
And the about.com team, how do they support you?
Well, I have editors that help me with the writing process and offer suggestions and proofread my content. And all of the health information that I write is edited by a medical doctor for accuracy. And that's true with all of the Health Channel content. Even that written by physicians is peer-reviewed by other physicians just for accuracy.
Angela, thank you so much for joining us to discuss your palliative care site on about.com.
You're welcome, Susan. Thank you for having me.
I'm Susan Dolan. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. Please visit our website at reachmd.com, which features our entire library of on-demand podcasts, or call us toll-free with your comments and suggestions at 888-MD XM 157. Thank you for listening.